Good morning and welcome to one in a series of ethnic media service briefings about the race to stop the spread and vaccinate all Californians against COVID-19. This series is co-hosted by Vaccinate All 58 of the California Department of Public Health. And I'm Sandy Close, Director of Ethnic Media Services and today's moderator. Today we explore a California COVID-19 vaccine success story, how Imperial County, an agricultural county on the border of Mexico that produces 2/3 of all vegetables consumed in the United States, went from having the lowest vaccination rates to the highest vaccination rates in the state throughout much of 2021 and all of 2022 thus far. In doing so, it beat out far wealthier coastal regions such as Marin County, Santa Clara, San Mateo, and San Francisco, including in vaccinating kids. 71% of Imperial County's children have completed the primary series of vaccines. Most counties have vaccination rates below 40% of children ages 5 to 11. Imperial County also increased its vaccination rates despite having the highest share of fatalities per population in the state, fatalities from COVID-19, an indication of the deep underlying health conditions that make residents so vulnerable to COVID-19. What did Imperial County do right? Has it been able to sustain its momentum? What lessons can we learn for other agricultural regions with far lower vaccination rates, like San Joaquin, Butte, Del Norte? Has its success resulted in permanent changes in healthcare access for its residents? We will hear from 5 speakers: Dr. Timothy Brewer, Professor of Epidemiology at the UCLA Fielding School of Public Health and of Medicine, and a member of the Division of Infectious Diseases at UCLA's David Geffen School of Medicine. Rocia Ramirez, MPA, Deputy Director for Community Health Division at Imperial County's Public Health Department. Jose Olmedo, Executive Director of Comité Cívico del Valle, Inc., and Daniela Flores, MPH, and Luis Flores, co-organizers with the Imperial Valley Equity and Justice Coalition, who will split their 8 minutes of fame. A few housekeeping items before we get started. We will send expanded bios of our speakers and a video recording of the conference to all attendees this afternoon with any collateral that the speakers want us and offer to share. We ask our speakers to speak slowly, as I am doing, for our interpreters. And believe me, that is hard because one gets caught up in what one's saying, and then one goes too fast for the interpreters to keep pace. We ask reporters to enter questions in the chat box, and we will take those up after each speaker as time permits. Speakers, please monitor the questions on the chat, and if there are any that you think you can respond to on the chat, please do. Now we begin with Dr. Timothy Brewer. Thank you for joining us and giving us an overview of where Imperial County fits in the state landscape on COVID.
So first, thank you very much for inviting me to participate and allow me to add my own congratulations to everyone in Imperial County on the outstanding job they've done getting people vaccinated. You should be very proud of this accomplishment. You're not only the highest in the state, you're actually one of the highest in the country. So the CDC reports that vaccination rates are 95% in Imperial County, 92% according to the Department of Public Health in California. But regardless, just an incredible achievement, which everyone involved in should be justly proud. So where do we stand right now as we enter the third year of our pandemic? So this is a coronavirus. It's a natural virus found in animals, jumped into people where it doesn't belong, and now has adapted very well for human-to-human transmission, resulting in what we now know as COVID-19 disease. We've had about 88 million cases in the United States, about 1 million deaths so far. Here in California, we've had about 92,000 cases, about 92,000 deaths and about 9.6 million cases. In Imperial County, you're just under 1,000 deaths and just over 60,000 cases. But the good news is that though Imperial County's case rates are about 37% higher than the state as a whole, your death rates are actually lower right now. So even though you had more deaths before, because of that tremendous job you've done vaccinating everybody, your death rates are actually lower than the states as a whole. And that's just a really terrific accomplishment. The vaccines are very good at preventing serious disease, hospitalization, and death. Less good at preventing infection because this virus changes as it replicates. So just to put some numbers on that, if you're unvaccinated, you're about 5 times more likely to become infected with SARS-CoV-2, the virus that causes COVID-19, than someone who's been vaccinated and boosted. You're about 7 times more likely to end up in the hospital if you're unvaccinated than someone who's been vaccinated if you became infected with the COVID-19 virus. And you're about 8 times more likely to die than someone who's not been vaccinated. So getting those vaccines and boosters out are incredibly important, and Imperial County should be very proud of what they've done, and I'm looking forward to learning from you about how you've done such a tremendous job. So I'll stop there, and I'd be delighted to answer any questions you have about the SARS-CoV-2 virus or COVID-19 in terms of how it spreads and how we respond to it. Sandy, you still have your mute on, so we can't hear you.
You are absolutely right. I am technologically a slowpoke. Thank you. One quick question from the chat about sustaining momentum around vaccines. Boosters have been a little slower to keep pace, and we're just wondering, what are you seeing in the town halls and the interactions you do across the state, but especially in counties like Imperial County? How are you seeing the challenge of ensuring people get boosted?
Sure. So the biggest challenge is actually misinformation. So there's a lot of information out on the internet that people have access to. And unfortunately, much of it is just frankly wrong. And so the kinds of things that I hear, for example, that if you get vaccinated, it will cause your blood to congeal. This is complete nonsense. There are no data to support that. This is a vaccine that has been given to 222 million Americans. We have a lot of information on this vaccine about how safe it is and how well it works. And yet, despite all of that information, if you go on the internet, you can find lots of theories about things that the vaccine does or doesn't do. And so I think a real challenge is trying to reach out to people, understand what their concerns are, and try to get them the appropriate information to address their concerns.
Thank you. A second question has to do with vaccination rates for the 5 to 11-year-olds and the toddlers. What are you seeing there, and how do you see Imperial County sustaining momentum, the challenge of sustaining momentum?
I suspect it'll be easier going forward for the youngest age group. So the 6-month to 5-year-olds, which were just recently approved for vaccination by the FDA. And the reason for that is that's a group of children that we're used to vaccinating. So we have a lot of systems in place for getting young kids vaccinated, particularly before they go to school. So I suspect that now that both the Moderna and the Pfizer vaccine have been approved through emergency use authorization for this age group, we'll see those numbers start to rise. The 5 to 17-year-olds are a little bit more of a challenge because that's not a group that we routinely vaccinate as much as the younger kids. But hopefully, as people recognize that this virus is still in our community and it's still being transmitted, that they'll see the importance and the benefits of both the original vaccines and the boosters.
Thank you. We have an important question from Renee Barbie with La Nueva Voz. Renee, do you want to ask your question?
Sure. Pomona has a 70.
Mute the background.
I can't.
Okay, quickly ask your question.
I'll just. Oh, can you read it for me, please?
Sure. I mean, the key question here is how can we turn around the number of people, for example, in Pomona, who believe the vaccine will cause lifelong health issues and therefore don't want to get vaccinated, including your daughter and your sister and your family. And that is just an important question, Dr. Brewer.
Sure.
There is no great magical answer, but what would your advice be to
no magic bullets. So what it boils down to ultimately is trust. And so individuals who are not vaccinated at this point, it's usually not because of lack of information. There's lots of information out there, and it's just a question of who are they trusting for their information. And unfortunately, they're not trusting individuals like me or members of the Public Health Department or the U.S. Centers for Disease Control and Prevention or Dr. Fauci. And instead, they're turning to other sources. And so what we have to do is try to identify people they trust. These could be clergy, this could be community organizations, it could be friends, it could be local clinics, and try to use that trust to get the appropriate information out to them. These are incredibly well-studied vaccines. There have been over 200 studies involving these different vaccines. And we have lots and lots of data on them. And it's just a question of trying to get that information in a format and through an individual they trust with the hope that we can address their concerns.
I have one last question for your 1 minute left from Eugene Levin. And Eugene, because of time, I'll ask it for you. Since there are refugees from war zones, Ukraine, and those people were vaccinated in Europe, how are those vaccines working with ours? And I realize this goes a little beyond our Imperial County focus, but given the high number of migrants who come from Mexico and may have been vaccinated in Mexico when they work daily in the Imperial County.
So the two primary vaccines used in Europe are the AstraZeneca vaccine developed at Oxford and the Pfizer vaccine, which we actually have here in the United States. And both vaccines actually work very well. The Pfizer's an mRNA-based vaccine tends to work a little better than the adenovirus-based AstraZeneca. But the good news is, if you have someone who received AstraZeneca or in the United States, the Johnson & Johnson adenovirus vaccine, and you boost them with an mRNA vaccine like either Pfizer or Moderna, you get an excellent response, very similar to if you had just used Pfizer or Moderna right from the start. So these people should do very well with the boosters we have available in the United States.
Thank you so much. We will go now to our next speaker, Rocia Ramirez, Deputy Director for Community Health Division at the Public Health Department of Imperial County. Rocia, thank you so much for joining us and for starting our view from the ground in Imperial County.
Thank you. I am going to share a screen here just to highlight some of the information. Can you see that?
Yes.
Okay, thank you. Okay, so, you know, I appreciate Dr. Brewer sharing some of that information that I think is really important. And so I'm going to try not to get into the depth of data and metrics and information. However, I do think it's important as we're speaking about vaccination, because of those high case rates and high COVID rates that we've seen in Imperial County, we know that that's also made an impact to our vaccination rates. Here and when some of those rates and how that has affected in our community. As you see here, we've had a couple of surges throughout in our county in terms of case rate information about COVID cases in our Imperial County. And we currently have a pretty high case rate of a 49.5% for 100,000 for last 7-day average. Although we've seen these high peaks, last one in this last winter, in the beginning of the year, the end and the beginning of the year, because we had high vaccination rates, we did notice a complete change and impact in our hospitalization and deaths. Even though we had some of our highest cases in late 2021, early 2022, our death rates went down as we started increasing our rates of vaccination. And so right now, our deaths have definitely been very low compared to early on before we started vaccinating our community. As you can see here, our first wave in 2020, we saw a huge case, a lot of deaths in our community, reaching our highest point towards the end of 2020 and the beginning of 2021. In terms of our hospitalization rates, again, that's also a huge indicator for us and some of the biggest impacts that we had in our community. Our system was heavily impacted with, you know, on average, we have about, before the pandemic, we had about 160 licensed beds in our community. At the height of our pandemic, we had about 260 licensed beds in our community, hospitalized beds in our community, of which at some point we had 205 individuals hospitalized in late 2020. The impact to our hospitalized system was huge, and really, you know, everyone in our community was somehow impacted, whether it was them individually or someone they knew was impacted and ended up either in the hospital or maybe they lost a loved one. We're a small community, so word gets around, people know each other, our circles are small. So people were really affected and they were seeing these devastated impacts. As vaccinations increase, although we've noticed our hospitalizations started to decrease along with our death rates. As it relates.
Rocia, what I should have asked is right at the start, what is the population of Imperial County?
Yes, our population currently stands at about 197,000.
Right.
Is our population.
Okay, thanks.
Thank you. So our COVID vaccine here, as you can see in California, this is within our California metrics. Currently, for all residents that are eligible for vaccination, we stand at 91.7%. Our 18 and over population stands at 91.5%, and our 5 to 11 population stand at 73.2%. In Imperial County, our vaccination rates among our school-age children, as Dr. Brewer mentioned, have historically been high. So we are noticing still a usage of high utilization of the vaccine among the population, even though we understand there are still fears among individuals of the impacts of the vaccine. But nevertheless, we are seeing a higher utilization throughout the state in Imperial County as it compared to other counties. And we believe that has to do just historically our higher rates within that population. So what did we do? You know, that's kind of one of the main questions. And as Dr. Brewer, I think, mentioned, there's no one solution, one answer to a lot of the things. I think it's been a collaborative effort, and we've been saying this throughout the pandemic, everything we've been through and how we managed to get through every situation has been in collaboration and partnership with our local medical providers, with our local community-based organizations, with federal and state partners, and our regional partners as well. In the initial phases of the vaccination, when we knew vaccine was very, very limited, and we knew we weren't, and you know, California started with a phased approach of vaccination. And one of the first things that we identified, and we knew very quickly, that we needed a plan, and we needed a plan that we needed to put together, not just with public health leading it, but in collaboration with those that were in the front line dealing with, you know, working with our population. So that we had two ad hoc groups that we started early on, and that was our immunization provider ad hoc group that included public health, hospitals, FQHCs, our medical society, and clinics and other medical providers. And they really helped develop that vaccine prioritization plan and provide feedback. One of the things that we wanted to ensure is that we were all sending the same message, that we were all planning this together, and we all had that, there was that buy-in from the community and from the medical community of how things were going to roll out initially as vaccine became available. This also helped understand what other providers were doing as vaccine became more available, so that we wouldn't duplicate efforts, and instead we would focus on the gaps that were available in our community, so that if we had to plan any clinics or targeted efforts, that it was based on where those gaps were, and again, not duplicate efforts throughout. Initially, our hospitals really stepped up the plate, and it was really because they had the most staff, not because other medical providers didn't want to do it, but because the hospitals had the staff from the get-go to be able to assist. And so initially, hospitals were involved, some of our local providers, with a lot of volunteers and community-based organizations also became involved in the vaccination efforts through our entire community. And that went from going to different locations, whether it was at a community center. We started with a drive-through clinics, and then went to the hospitals, helped set up clinics, and then further over to schools, to working with farm labor groups, working at wherever we could and wherever agencies could, they would set up shop to make the vaccine accessible within the community and not just in one location. We also worked with an immunization communications ad hoc committee that focused efforts working with community-based organizations or organizations that had targeted efforts. In the beginning, we looked at based on that rollout, who was working with the senior, mainly with the senior population, or who led efforts that were connected to groups that worked with the senior population. Those that were working with the farm worker population, like Comité Cívico, was the LGBT center that worked with a lot of the younger population, Ventanillas de Salud, and Clínicas del Pueblo, who is our FQHC in our community and has clinics throughout the region in a lot of our rural areas. And this group really helped us in developing messaging and outreach strategies, as well as providing feedback in terms of for our vaccination communication rollout.
Just a quick question there. Is there a single message that you think really resonated that you were promoting to make it less confusing for people to have a single message?
Yes, and that's something that the group identified very quickly, that we wanted to send that single message. Whatever was being put out was the same information instead of duplicating that information. So Imperial County led the team with developing campaigns, developing information, message points, toolkits, and then the agencies providing feedback took that information and shared a lot of that information through whatever efforts they did. So that was really helpful so that we didn't have these different messaging going around.
And you summarized in a conversation with me that that message was trying to keep the community safe. We can't do this alone.
Correct.
Did I get that?
Yes. So we had, we've always, we doing this together, and that was always our message, and I'll share with you some campaigns that we put out that talks about the message and bringing the community together. So it was not just about us making this happen, our community, our partner agencies making it happen, but also our community being part of the solution and part of carrying out, our response related to COVID.
So sorry, because of time, we have questions in the chat. So do you want to just make a concluding remark and then let me save some of your time for Q&A?
Sounds good. So I'm just going to kind of wrap this through. So we had different partnerships. We worked with different agencies. We went out in the community. We worked with employers to try to identify, and just we did different campaigns throughout the vaccine. Help Us, Help Them campaign was a campaign that encouraged others to help those individuals without access to computers, that didn't know how to navigate the internet, to help them and get connected, find a vaccine clinic. And so a lot of people came on board, partners came on board, and really the family members, this was a huge buy-in that really kicked off and initiating our campaign. I Got Vaccinated campaign was another one that it highlighted local community members that received the vaccine to encourage others. Together to Immunity was another campaign that promoted that general vaccine information. And we all, again, use local community leaders and members so that people can relate to them. And they were on radio, billboards, newspaper, whatever ads we can do. And again, we've had others, Booster All the Way, which is another campaign that when boosters came available, and we're currently working with medical providers and pediatricians to help support additional booster campaign messaging. So that's been really critical. We saw that, the CDC or CDP or the California Department of Public Health messaging was very general and the pictures were really nice, but we wanted people to relate to those individuals that they were seeing, sending the message. And that's why we brought that local feel to our messaging.
Okay. Thank you. We will share, if it's all right with you, we will share your slides with all the attendees. But two very quick questions, one from Juan Esparza at Vida and El Valle. Juan, because of time, I'll read your question. Has or does Imperial County share best practices with similar counties like Fresno and Tulare on how to get the message out to the Latino community?
We've been sharing this information wherever we get invited, or as I know our public health department leadership it is part of different groups. We are now working more into the equity with equity groups and try to share, again, best practices and lessons learned. I think we're still learning. The journey has not been perfect. I will say that for sure. And we continue to learn as we progress, as different things come up, but we would always, make that available as
Here's
people
a quick question from Diana Martinez at San Fernando Valley Sun. Are you encouraging your residents to still wear masks and avoid large crowds? There in Los Angeles, there is, of course, a desire for people to return to normal, but there are numerous breakthrough cases and numbers are seriously rising again, so that mask mandates are expected to come back. What is the situation in Imperial?
We continue to recommend that individuals take the different precautions, the different layers approach that we keep on sharing. Masking is one of those. It's not a requirement, it's not a mandate, but we highly encourage, especially, and we send those reminders as well as we continue to see a rise in the cases and our community transmission. Yes.
Okay, and one last question. There are more questions, which maybe you can check the chat, but the role of growers and farmers, was that something that the Department of Public Health made a concerted effort to coordinate with growers?
Yes, we worked with the Farm Bureau Association, we work with Vegetable Growers Association, we worked with Imperial Valley Economic Development Corporation and others, as well as some of the community-based organizations like Comité Cívico is present. I'm sure they'll speak more on some of the efforts that they also did. And we worked at different agencies. We reached out, we worked with them and helped coordinate clinics at their sites as well, and made those available. We went to farms, we went to packing sheds and those different areas, and it was a very good response.
Well, thank you, and thank you for joining us, and please stay on because there'll be more questions. So our next speaker is Luis Olmedo, who is Executive Director of the Comité Cívico, which Rocia Ramirez referenced, and who is going to give us a view from within the front lines of the farm worker population of Imperial County. Mr. Olmedo, thank you so much for joining us.
Yeah, thank you, Sandy, and it's a great pleasure to join the panelists. It's a great opportunity to highlight some of the good things and opportunities that are still need to be resolved. But not to be repetitious, I did want to start and say that Comité Cívico has been around for 35 years, and it's only been in the last 20 years that we've actually been getting more involved because of the need on emergency response. Before the pandemic, we've had endemics, persistent endemics. So a pandemic only means the entire world is experiencing, a crisis such as we did with this virus, but we are experiencing that all the time. At this point, we're experts. This is an area where we are experts of endemics, and we're not unique. There's a mention of San Joaquin, there's Coachella, there's many communities up and down the state of California that are facing the same crisis because of a lack of investment in healthcare. But some of the early things that we've been involved with have been responding to earthquakes, responding to floods, responding to fires. And we haven't been, and look, let's face it, yeah, the county has a better administration today, but we do come from a history of 100 years of economic and racial discrimination, where the majority of the people have been the workers and few people have held the power. And that's the agriculture industry has held the power. We are in this situation because we were left alone to fend for ourselves in this border community. And for that reasons, a lot of people fell through the cracks over the decades. And we've had to respond and help our communities at their request. And so we are not part, still today, in statute, as part of the emergency response system. So some of the things that we did is we spotted right away when there was a call out for essential workers, right? So we still need essential workers. Well, where are many of our essential workers coming from? Across the border. And the federal government never stepped up to put a single mask, a single sanitizer, a single anything. They did nothing. On the contrary, they dehumanized that border crossing experience. And that's where we began with my partners. I'm really glad to see Luis and Daniela. They're wonderful partners. We continue to do many things together. And so that's where we launched the first effort of Salud Sin Fronteras. And it wasn't the state, it wasn't the federal government, it wasn't the local government. It was private donors who says, you know what, we don't want a name attached to it, but here is thousands of masks, here's thousands of sanitizers, do what you do best. That was the first dosage of PPE that we got, okay? And that's important to keep that in mind, that cannot repeat into the future. We have to change that. That was the first sort of initial seat that launched the Salud Sin Fronteras, Health Without Borders, because we started at the border, making sure that on both sides, there was a foundation in Mexicali who agreed to volunteer. We provided them these donated supplies from a private donor, and we were doing it on the US side, but immediately we realized that, hey, there's a need across this entire rally, so let's start getting this out. So we organized as a coalition, numerous organizations that worked under that effort. The other thing that we found is that as we were getting these, thousands of these supplies, eventually, we were able to tap into resources coming from the county, from the state health department, Office of Emergency Response, and eventually FEMA stepped up and said, hey, look, we got supplies, and they started shipping us. So I do thank the county for allowing us space to store these supplies, because we did need a warehouse that had an unloading dock to be able to get these supplies out. So we did have a lot of boots on the ground to get out there. But even before then, we already knew, because of the numerous times that we responded to emergencies, we already knew that the community-based organizations were there. We've always been there. We've always been picking up, where government hasn't, been able to cover, or people fall through the cracks. We've always been there. We're always addressing and responding to the harder reach populations. And in a perfect world, we wish for that when the first call for resources to go to extinguish this pandemic would have been, let's bring the community-based organizations along with us who have that experience, who have that access. But the reality is that some of the numbers that were meant between 2021, 2022, and we almost spent a whole year before it was actually official that community-based organizations needed to play a key role in this. And we eventually did. But before that, again, it was Salud Sin Fronteras, kind of doing our own work. And then finally, we got to partner with the county. A lot of that was said, I appreciate it, because all of that happened, right? But we didn't have to wait that long. And I don't know where that call comes from. Is it the state level? Is it the federal level? Do we need to put it in the law? We should not allow situations like this to happen again. There was needless death that could have been prevented. So the other thing that is important is that when the tiers, that eventually we had the vaccine and the tiers started coming out, all we had was the CalVax, the PrevMod, and those databases did not guarantee that those at the highest tier that were the most vulnerable and highest priority were going to get the vaccine. In fact, we ended up with that Titanic experience where people are trying to save themselves, right? And so it was, unfortunate the situations played out. They're well documented in the newspapers, but we ended up creating our own database that was far superior still today from PrevMod, CalVax, or MyTurn, because we were actually able to make sure that we vetted people that were going in, that they actually represented that, that population that was next. Otherwise, they couldn't register to get that vaccine. We also were able to provide, even before the National Guard was deployed, our community-based organizations were deployed with vests, clearly marked, with the logo, Salud Sin Fronteras, and we all dressed the same way all across this valley, trying to expand and get as far as we can. The growers played a critical role in this because we started seeing immediately that there was outbreaks, and some of the more notable ones within our beef processing plant, and some other similar types of scenarios. And actually, it was the Attorney General's office who stepped in and eventually responded to that issue, and eventually was able to engage us and get in there. But the growers did open their doors. We were able to partner, I guess, as a coalition with different medical providers, with pharmacies like Desert Pharmacy, Pioneers Healthcare District. I know on the southern end, you know, Dr. Bo, and then eventually Dr. Bo was everywhere. So I really thank a lot of his efforts and our partners from Equity and Justice Coalition, Salud Sin Fronteras, and many, you know, we've all tried to get as far as we can, but we did provide a lot of volunteers, a lot of boots on the ground. And I'll be honest, you know, I actually at one point did request, maybe it was a dumb request, but I said, can we get help from the National Guard, right? And that was like, no, you're not, you know, you can't get that, you know? So I don't know, you know, I mean, I think that there's a lot of outdated laws and policies that need to be fixed, and we need to take that opportunity to fix them today, because we should never end up in another situation where we don't have funding already set aside for the community-based organizations to be deployed. They need to be a core part of the emergency response system. Are we doing better? Yes, but we still had a lot of deaths. We still have a lot of endemics right now. And I didn't see a single dollar being dedicated to CBOs that go through the health department or go through wherever, because up to this day, we haven't received a single penny. Salud Sin Fronteras and the coalition has not received a single dollar that has come through the emergency response system. That starts, I guess, at the state, you know, Office of Emergency Response, county. We haven't received a single dollar. So yeah, thank you, like, you know, but we're here trying to help you, right? We're not, you know, it costs money to mobilize people. It costs money to pay for fuel to get across this entire valley. We also want the vans so that we can get around and provide a cool space for our teams. But I'll tell you that who really stepped up was philanthropy. They put a whole bunch of resources, and I thank the philanthropy for being able to do that and being able to get these dollars to a lot of our community-based organizations, including creating what you know, similar strategies that would be political campaigns, where we would get, you know, dozens of people on and knocking on doors and making sure people had the right information so that they can access, you know, vaccines. We had, I don't know, dozens of iPads going out there and registering. So again, a lot of these things are things that did happen.
Let me.
I'll take a pause there. I think
okay.
I covered most of the things that I wanted to cover. I think the more important one right now is we had a surplus budget. And I did not see a single dollar being dedicated to CBO so that there is an emergency response, because we are in crisis. You know, there's floods still happening. And with climate change, you know, you're going to see more intense floods, you know, earthquakes. We're going to see, you know, heat-related, you know, fires. And we're going to see other things like such as COVID that may happen. That aside from all the endemics that exist here. And we need to change the old way of how we've always done things. And one of those things we need to do is we need to be there hand in hand with the emergency response system. We cannot be calling at the middle of a crisis, begging for PPE, begging for resources. We can't do that. If philanthropy didn't step up, we wouldn't have had anything. And still today, even with the ARPA funds, that's a great opportunity right there. And still, like, I haven't seen a single dollar dedicated to this effort. So I'm not trying to take away from all the good. I mean, I think Rocia mentioned some really great things that we did. I'm sure my colleagues, Equity and Justice, will mention some great things. But I thought my best use of my time is saying, what are those things that we still need to be able to
Right. A very quick question for us now, before we move to our last speaker, and that is, how do you assess the overall health and the push for increasing boosters and vaccinations for the youngest kids. You've done a great job. What are your major concerns at this point with expanding, keeping the momentum and getting the vaccinations and boosters to the most vulnerable?
Look, you know, in the late 90s and 2000s, we worked on HIV. And then when people stopped dying in the numbers that they did, then things started slowing down, right? And so I'm afraid that we're going to see the same situation where we're going to get comfortable. Not enough people are dying. You know, we don't give enough value to human life. And so I think we need to keep those strategies going, because it's not just helping the strategies, meaning like we got to continue to go out there. We got to continue to provide access and registration for the vaccines. We need to continue to educate. You know, we need to give people their space too. You know, some people, you're just not going to convince them. There's no reason for us to have to try to convince them. You know, the majority of the population are, you know, and need to have the right information. And so I think we just need to continue everything, all the strategies that we did, the campaigns, the education, the collaboration, but at the same time, find ways right now of how we share that resource, because we know that, and we know that in all our state government, all our federal government, we know that government isn't like the old days, like we're not blinded anymore. It's not like, oh, government is here, we're here to save you. Okay, we know that you can't do it alone. We're gonna do it together in partnership. And so we need to share the resources. And that's one way to keep these vaccination rates going. That's one way to, if we want to continue in the same way, we cannot slow down. We got to speed up.
Okay, I've got to shift now to our last speakers. Thank you so much for this perspective and the emphasis on, which I think Rocia also emphasized, the critical role of the community-based organizations. Now we take a step closer to the grassroots with Daniela Flores and Luis Flores, co-organizers of the Imperial Valley Equity and Justice Coalition. And we start with Mr. Flores, your sister and brother, right?
Yes, we're a sibling duo.
Okay.
So good morning, everyone. Thank you, Sandy, for the invitation. Thanks to the staff at Ethnic Media for all the prep work. And we're really grateful to have this opportunity with these panelists to celebrate the success of the many sectors and collaborations that made Imperial a high vaccination county. Given our county's high rate of COVID-19 infections and deaths, our high primary shot rate is both a cause for celebration, but also a bit of a puzzle. Like with most things, a single explanation is unlikely, and there's instead many causes at play, from state programs that targeted essential workers, of which we have many, to the county's efforts and its many collaborations with ag work sites, for example, and nonprofits who work to vaccinate the hard to reach, including Mexico residents with US PO boxes that could get vaccines here. But I want to point to a factor that I think gets less attention. And I want to suggest that part of our high rates of primary series vaccination has to do with politics and the intersection between politics and race. By the start of 2022, political ideology was the strongest predictor of vaccination status, rather than race and ethnicity alone was a stronger predictor. The relatively low proportion of white conservatives in Imperial County, as compared to other counties, plays a less appreciated role in our high rate of vaccinations. So I'll provide some context for this perspective. When vaccinations first started, Latinos across the country lagged significantly behind the white population. But between July and September of 2021, the rate of vaccinated Latinos jumped from 61% to 73%. Politics seemed to be a strong predictor, with a Gallup survey in late 2021 finding that 92% of eligible Democrats had received at least one vaccine, while only 56% of registered Republicans had. By the start of 2022, a largely white anti-vaccine movement turned some of our expectations about vaccine access on its head, about who would be getting some of these treatments. Imperial has by far the highest proportion of Latinos of any county in California. making up 86% of residents compared to the second highest, 65% of Tulare County, a 20-point difference between 1 and 2. Imperial County voters also overwhelmingly voted for Democrats in the 2020 election, with 64% voting for Biden, 33% for Trump. And even this large voting gap doesn't capture the politics of our non-voting resident and undocumented immigrant populations. Notably, Lassen and Modoc counties, named by a CalMatters study, the quote Trumpiest of counties, ranked dead last in primary shot vaccination rates. We can also look within Imperial County for some clues about this. A city-by-city breakdown of vaccines in May of 2021 showed a similar puzzle. Calexico, our most Latino, but also most disadvantaged large city, was keeping up with vaccinations and was slightly ahead in proportion when compared to the county seat of El Centro and to higher resource cities like Imperial and Brawley, which also house our county's pockets of conservative persons. The town of Imperial and Hopeville, for example, were centers of small anti-masking mandate movements in early 2022. So we should be celebrating the successes of our county-wide efforts, and my sister will speak to some of the efforts, but we cannot ignore the central role of anti-vaccine politics over the last 2 years. Imperial being an outlier in both the high proportion of Latinos and also a lower population of white conservatives must be having an impact on our vaccination rate. So I'll turn it over to Daniela.
Daniela.
Good morning. Thank you, everyone. Thank you, Sandy, for having us. So I'll be taking on the question of where our efforts are now and share about the work grassroots organizations did to vaccinate communities in Imperial. We also consider the sustainability of this success. So I want to begin by highlighting that while Imperial is ranked 1 out of 58 counties in the rate of primary series vaccinations, meaning that full vaccination without a booster, we rank 49 out of 58 counties when we look at the rate of eligible boosted populations at 47.5%. So that's a number that hadn't been presented yet. This tells us that something about that initial year of vaccinations went very well, and that might not be carrying on to the booster efforts. So what did local grassroots organizations like ours do in the first year? In the early months of vaccine rollout, our coalition focused on addressing important gaps to reaching some of the most vulnerable communities, like Spanish-speaking communities, older adults, and agricultural workers. Farm workers face many barriers to vaccinations, lack of routine access to healthcare, or limited familiarity with healthcare systems, challenges with technology to access appointments, transportation, distrust of government, folks not having an email for appointment reminders and confirmations. These were all too common among the groups that we mentioned. So to address this gap, together with other CBOs, we began to work with healthcare providers, as Luis Olmedo mentioned, pharmacies, hospitals, and community clinics to secure vaccine appointments for these groups that were hardest to reach. So we set up a Spanish language hotline where folks would be able to call to get into a pre-registration list, working with providers to reserve slots for farm workers. We would call back farm workers at a time that we knew they could pick up the phone when a clinic was announced and made the appointment for them. So we also conducted extensive in-person outreach and vaccine pop-ups in downtown Calexico, where thousands of Mexicali-based farm workers cross for work daily. So for the hardest to reach, the necessity of boosters continues to pose major barriers. When returning calls for booster information, for vaccine information, we found that farm workers did not have reliable phone numbers. They moved seasonally and worked during those clinic hours. Our low booster rate means that we can't move beyond COVID. As we speak with you, Imperial County has a test positivity of 40.2%. Nearly 1 out of every 2 people testing positive. Trusted on-the-ground CBOs were essential to early vaccination efforts, and they need to continue to play a central role in booster campaigns. As Mr. Romero mentioned, funding for CBOs is winding down. Priorities of the county shift to other matters. We see less of these strategies used to fill gaps of the vulnerable communities that were used in the early months of vaccination. So while we celebrate the early vaccination efforts, we consider the vulnerability to the new variants and the ones that will continue to show up. And our booster rank at 49 out of 58 should be cause for alarm. So let's remember the strategies that made us successful and in reaching people for their initial vaccines and sustain them through the booster campaigns as well. With that, I will thank you all for your time and happy to take any questions.
Well, this is great. Now I have to fold in questions. Since we only have about 5 minutes left, I'm going to ask each of our speakers for a final word rather than allowing time for questions, which I wish I could. But there have been some great comments in the chat. I hope everybody is also checking out the chat. The question really is, we all acknowledge Imperial County has tremendous lessons for all of us in the state. And this is a celebration of Imperial County's success. Each of you played a key role in that. It's also an important message from the California Department of Public Health and its Vaccinate All 58 that, as you said, Daniela, booster rates, well, all of you have said, we've got to focus. We can't stop. We have to sustain the momentum, and everybody has to do the best they can to sustain the campaign to boost everyone and vaccinate everyone. The question I have for each of you is, what can we see over and above fighting COVID that Imperial County has been able to do to address healthcare disparities in the long term? Are there long-term changes? Certainly mobilizing the population and achieving these high vaccination rates has been a tremendous educational success. But what would you say is your biggest concern looking forward about the capacity of Imperial County to deal with what Luis Almeida refers to as perpetual endemics? The overall healthcare, has the pandemic been a one-time only success, or do you feel you've moved the needle on what it needs to be done moving forward? And maybe I'll ask Dr. Brewer to start and then go to Rocia and then our last three speakers.
So I'm probably the worst person to answer this question because I don't know much about Imperial County, unfortunately, but what I can say from my experience of having tried to build healthcare programs around the world in low resource settings in about 30 different countries, including sub-Saharan Africa, is the critical importance of partnerships and trust. And so whatever partnerships you have created and whatever trust you have established from going through this process of getting vaccines out, try to use those to build on the other issues facing your community.
Right. Very, very good message. Rocia Ramirez, going forward, what do you feel the County Department of Public Health has learned and is stronger because of it?
You know, as I think we may not have as I mentioned early on in my presentation, there was a lot of lessons learned, and we're still learning through this process. We have not, we're not perfect. And I think our goal is to continue to learn from where we at, continue to move forward, continue to build on these relationships, and continue to build on a plan that we can utilize, as Luis and others have shared, so that it's not just based on this response, but in future responses. And we're not there yet. I'm not going to say that we have a plan in place that's going to be replicated exactly as it is, because we're not there yet. But we hope that with funding that's been made available, that we continue to expand on some of these areas, work with these CBOs, work with others in our community to build on the infrastructure for future needs. And that's something that we will be highlighting in this next year, and working from those lessons learned that we've had in the last 2 years.
That's very helpful. Luis Olmedo, looking forward, you've made a very strong point about the need for funding set aside, so immediately community-based organizations can be brought to the table, that there won't be the delay. They can be seen as essential partners. What do you see as hopeful, most hopeful, out of where the county is at, having fought for higher vaccines?
Look, you know, as an organization that's been around as long as it has, and me being around for quite a couple of decades now, I'm very pleased of how much progress has been made. We're one of those test communities of how things were done in the past and how we're fast tracking into a more equitable, a more just future. But there's still people, you know, that are embedded into the healthcare system that need to be weeded out, or they need to be, you know, given retraining. And so we need to be there to help people like Rocia, help people like our health director. There's a lot of good people that are stepping into these positions of power, and we need to be able to help them. And sometimes they might need state policy, right? If they can't do it locally because whatever reasons, political reasons. Two things I just want to highlight is, one is we have to respect the knowledge and the power in communities and where they're at. We mentioned several communities. Each community, there's no cookie cutter. Each community has its power, its knowledge, and its experience. And let's not forget that if we are facing greater mortality or impacts from COVID, it's because our immune system is already compromised because of the repeated assaults of all types of impacts, of environmental impacts, of water and air and what do you call it? Anyways, I'll stop there. The one thing I want to close with is, I want it to be a loud message to the state of California and to the federal government. And if the state listens to us more, because I know that they're kind of closer to us, is we need it in the law. We need community-based organizations to be put in the law. And I hope that a legislator and our governor hears this, because we can no longer do things the old way. And I know they will do it. I know they can, and I know they would appreciate this. That's why I'm saying it. We need to put community-based organizations in making sure that they have a seat in the emergency response, and that we have funding dedicated so that we're able to quickly respond with all the red tape. Because when people get into crisis, we can't wait weeks until there's a boat to be able to get them the help.
Thank you. We have 1 minute left. Luis or Daniela, who do you want to take that?
Very briefly, I'll take it. I think I'll just emphasize that for many in our community, COVID was one of the first experiences with accessible, free / affordable healthcare where health services came to them at their point of work, at their places of transit, sometimes to their homes or their neighborhoods or their schools. This should be the way healthcare is, right? It should be going to people, it should be free, and it should be accessible. And so I think this could be a model for how we do medical provision in these kinds of communities more broadly.
Thank you. That's a tremendous message from all of you to close on. I want to thank the California Department of Public Health, Vaccinate All 58, for supporting our exploration of the Imperial County success story, what we all have to learn now and for the future. You've been a terrific panel. Thank you so much. Our conference is now closed. Okay.